वेलकम बैक व्यूअर्स ऑन हेल्थ मेयर्स। मैं हूं आपकी होस्ट सारा अंजुम और हम बात कर रहे थे डॉक्टर कुमार के साथ ऑन एलर्जीज। और ब्रेक से जाने से पहले हम बात कर रहे थे कोल्ड एंड फ्लू के बारे में कि वो उन दोनों में डिफरेंस क्या है। आप हमें ईमेल कर सकते हैं healthmares@healthmareslive@gmail.com पे अगर आपको कोई क्वेश्चन हो। आए हम जाने और कि कोल्ड और फ्लू में क्या फ़र्क है और हम उसको कैसे प्रिवेंट कर सकते हैं। यस डॉक्टर, so you were saying that flu, when a person has flu, their body starts to ache, and it's a viral as well.
Exactly.
So, and like you said that if someone has cold, they're not going to get it from the air. Someone has to be next to you. So
Yes.
could that be stated as viral as well, or
Exactly.
that's a different?
Both of them are viral. Common cold as well as the flu, both of them are viral. But flu has greater potential to cause complications, especially in very young people, very young children, and elderly people, especially if they have other problems like heart problems, diabetes,
Yes.
kidney problems, congestive heart failure. They cause serious problems. Actually, it is one of the leading killers in elderly people.
So they can get flu by if they're sitting next to somebody or if they drink someone else's drink. So these are the possible ways
These
they
are the
can get
possible
flu,
ways.
or someone sneezes in their face or coughs. So they can adopt the virus and get sick with it.
Exactly.
Okay, so we can prevent them by using our napkins while we're about to sneeze or about to cough.
Exactly.
Or
Always cover your nose when you sneeze, because you may carry a virus, cold virus or flu virus, without even knowing it.
Yes.
You may have a flu which you may not know. You may feel a little bit of symptoms, especially if you are a young person in great health. You may not feel all the symptoms at all.
Yes.
And that may be deadly for a very elderly person.
Yes. So, Dr. Kumar, can other conditions be misdiagnosed from allergies, and they would not think they have allergies, but they actually do have allergies?
Not likely, because when you have allergies, especially when you have seasonal allergies to pollen and plant material coming in a particular season, it usually follows a clockwork. Every springtime or summertime, depending on what pollen you are allergic to,
Yes.
it keeps repeating every successive consecutive years.
Yes.
So that's the way usually patient already knows, oh, I have seasonal allergies, must be hay fever and things like that.
Yes.
And on the other hand, if you have indoor allergens, you could have indoor allergen allergy in addition to seasonal allergy. So you have a problem throughout the year.
Throughout the year.
Yeah.
So you're going to be home, you're going to have allergies,
Exactly.
you're going to have all the symptoms, and you go out in the spring or the fall, they're going to be the same thing.
Yeah.
So what would you recommend to those type of patients?
Like I said, they should get tested and find out and pinpoint what allergies they have. Once they recognize their particular allergies, we can advise them how to prevent. In case of pets, in case of dust mites or cockroach or seasonal allergies, we can advise them accordingly. And in addition, if the symptoms are very bad, they can use antihistamines and sprays to spray the nose
Yes.
daily during the season. Or if it is throughout the year, unfortunately, they may have to use it more often than seasonally. In many cases, it will be throughout the year.
Yes.
And also, if these measures don't exactly help to full extent, we have what is called as allergy shots.
Allergy shots.
In otherwise, we call it in medical terms, medical language, immunotherapy.
Immunotherapy.
That takes a long time to kick in. It takes almost a year to kick in, because to achieve the right dose, the therapeutic dose, what we call,
Yes.
it takes that much time. You cannot have the therapeutic dose as soon as you get diagnosed, because that will be a disastrous reaction.
Yes.
So we have to build up slowly, increasing the doses every week to 2 weeks. And when you reach that dose, you will start noticing the result.
Yes. Dr. Kumar, when we go out to the pharmacy such as CVS or Rite Aid or Walgreens, they have boards outside saying free flu shots, or in the hospital. Should patients get, or patients or people who don't have allergies should get flu shots on when it's provided, or they should just get it to prevent getting any flu or any viral?
Anybody can get a flu shot to prevent flu infection in the flu season, but it is medically recommended to people who have certain conditions like asthma, kidney problems,
Yes.
and elderly people, this kind of patients. Somebody who is young and good health, whether they need a flu shot, it's up to them. It's not medically indicated,
Yes.
but there is no harm in having it.
So a person can still get a flu shot just
could
to
still get it,
prevent
yeah.
future or any
Yeah.
flu that goes around, right?
Yes.
Okay.
But the
Doctor,
flu shot has to be taken every year.
every year.
Yeah.
So they cannot miss it? Or is it okay if they take it
cannot.
1 year and then miss out the next
Yeah,
year?
it has to be taken every year because the character, the molecular character of the flu virus changes year to year.
Okay,
So they have to manufacture a new vaccine every year,
every year.
unlike every other vaccine which is not changed frequently.
Yes. Okay. So, doctor, when people have all these symptoms, they're recommended, like you said, there are medicines and there are sprays that they use. Is there any alternative thing that they can use, or they have to use medicines to get rid of their symptoms?
They have to use medicines to get rid of their symptoms, and the avoidance once the allergens and the pollens are recognized goes a long way in preventing allergy symptoms. On the other hand, there are many Ayurvedic medicines, native medicines, which I am not trained in, but I'm sure will give great relief, but not a cure, but will give relief.
They will soothe that, like for example, us, like we Asian people, we drink ginger tea, or we have lemon tea and we add some some honey into it.
Yeah.
So that soothes the itchiness or the throat sore that we have.
Yeah.
So that's would be recommended along
Yeah,
with the medications?
I strongly recommend it. Anything, ginger tea or any other decoction made out of Ayurvedic medicines,
Yes.
most of them act by increasing mucus production, making the mucus thin. How they do it is just by how the cough medicine acts.
Yes.
When you swallow cough medicine, they stimulate the receptors in your throat and also in the pharynx and upper airways to produce more watery mucus in the lungs so that you
Yes.
can easily cough it off. That's the main way by all these Ayurvedic medicines work. In addition to that, these ginger and especially turmeric, they also have some antibacterial, antiviral properties, I am
Yes.
told.
So they would help along
Yeah.
with the medications
Yeah.
when a person is sick. All right. Doctor, I would like to know that what is hay fever?
Hay fever is nothing but seasonal allergies which were during late summer season. It is not allergy to hay. Hay is, the dried grass. In
Yes.
hundreds of years ago, when people went to collect dry hay for
Yes.
their cattle, they always used to get sneezing and runny nose and allergic symptoms.
Yes.
So they called it hay fever. And to make the long story short, we now know that it's not the hay itself which caused the allergies. Anything which is lying outside, a living matter, will be infested by molds.
Yes.
So it is the molds which is in the hay
Yes.
were causing the allergy symptoms.
Yes.
But anyway, because it's an age-old name, the name stuck. It's not going away. We say hay fever now for any pollen allergies.
Okay. So like you said, it's seasonal fever which comes in end of summer. So some people get allergies when spring starts,
Exactly.
and some gets when summer's ending and they're getting into fall.
Exactly.
So that would be hay fever, and they would
Yeah.
have same symptoms as an
Same
allergic,
yeah,
like
allergies.
itchy nose, watery eyes, stuff like that,
Exactly.
itchy ears as
Yeah.
well, right?
But no fever though.
No fever.
No fever. Though you may feel weak and malaise, meaning no interest in anything, these things can happen,
Yes.
though if you don't have fever, but they called it fever anyway.
Yes. So, doctor, going back to the food allergies, can a patient develop as being old? Can they develop food allergies instead of young children?
Yes, they could. They could develop food allergies as an adult.
And their symptoms would be same, like
Symptoms
throwing
would
up
be-
or swollen lip or...
Symptoms would be same, yes.
So how can...
Depending on how severe it is. Throwing up and swelling lips and tongue, these are more extreme variety of allergy, but most common ones are itching, rashes.
Okay. So doctor, now it's time for a short break. फिर हम जल्द हाजिर होंगे एक छोटे से ब्रेक के बाद हम और जानेंगे फूड एलर्जीज़ के ऊपर कि फूड एलर्जीज़ क्यों होती हैं और कैसे उनको हम प्रिवेंट कर सकते हैं.